Good morning. Welcome to MagnaWave Office Hours. I'm Pat Ziemer, CEO of MagnaWave. I'm glad to be here with you this morning. As you know, we come to you every Tuesday morning at this time to answer any questions you may have about PEMF, pulsed electromagnetic field therapy, MagnaWave, devices, training, just general wellness questions, whatever it may be. So there's several ways you can communicate with us. If you'd like, you can send me a text to 502-599-9722, I believe, and I will call you back and we can have a discussion. If you're listening on Castbox, you can click the phone icon and I will be notified and I can take your call at that point. We can have a conversation that way. If you're on Castbox and you want to speak with me, if you'd be so kind as use your headphones so we don't get any reverberation or feedback, if possible. So the Castbox is the second time we've utilized Castbox, and for those of you who aren't aware, Castbox is a radio type of program or format that you can listen. You don't see anything, but you can listen just like you would listen to a normal radio. If you'd like to post a question on YouTube, you can do that. Just put it in the comment box on YouTube or on the Facebook in the chat box on Facebook or the box underneath the feed, and I'll get those questions and be able to answer them as well. So we're glad to be here. So if you have any questions, go ahead and put them up, and we will get moving at that point. I want to remind you that if you have an Alexa device and you'd like to follow the daily flash briefings from MagnaWave, where we bring you up to speed on history and various indications and protocols and a lot of different information that's available to you on a daily basis in a very short 1 minute or so clip, go to Flash Briefings, Alexa Flash Briefings, and search for MagnaWave, and you'll be able to hear the daily Flash Briefings from MagnaWave. If you have information that you would like to find, a great place for studies and information about PEMF is the AOPP, which is the Association of PEMF Professionals. You can find that at PEMFprofessionals.com, and you can search for any indication that you're looking for and find studies that have been completed with regard to those questions that you're asking. So the AOPP, if you're a practitioner and you'd like to further your professional involvement, the AOPP would be a great place for you to go and become a member of the AOPP for their additional training and information that's available to you as a practitioner. A great way for people to find practitioners. Also on the MagnaWave website, you can find practitioners as well. So a couple things that you can do, a couple places you can go to get your questions answered. Let me take a look here and see if we've had any questions at this point. Let me come over to Restream. Let's see. Good morning. Hey, Jamie, Maureen, thanks for being here. Jeff, good morning. Thank you for being with us. And Aaron, Director of Training, is with us as well to help us out this morning. So any other questions, just put them in there and we'll have a look at them. Do have a question that was brought up to me. How soon can I MagnaWave after hysterectomy surgery? Well, and this holds true for most anything that we do. Once the bleeding is controlled after, whether it's a wound or a surgery or anything like that, once you're stable and everything is pretty much in good shape, so with regard to bleeding, then you typically would be free to treat. You always want to talk with your doctor if you just had surgery and tell them what you're wanting to do to help the healing, help the pain, inflammation reduction, and so they understand what's going on. But typically, once things are under control, you can go right to it and begin treatments after a hysterectomy or any other type of surgery. Let's see, any other questions? No. Another question that we've had, advice on treating arthritic shoulder pain. Client has scheduled 3 treatments, started today with 10 minutes on each shoulder, used the small loop on a low setting. The client was a bit skeptical. Well, what I would recommend and what they go on to ask for is what is the best protocol to use. And certainly when you're dealing with someone for the first time, you want to make sure they are comfortable and that they can adequately feel what you're doing, but you don't want to present too much energy until they're used to it and they know what is going on. So you're correct, I think, in utilizing the butterfly loop to go over the shoulder in this fashion. You certainly could use the large loop, put your arm into the shoulder and rest it on your shoulder to treat this way into the upper shoulder and the body. With regard to intensity, it talks about you were using a low setting, and what I would strive for is comfort. I would gradually turn up the machine, or depending which machine, if you have the semi 3 or semi 5, you have fewer settings, but you can go, I would turn it up and I would get the customer to be comfortable. If they can feel it, that's fine. They don't have to feel it, but if they can feel it, that's fine. And then you want to give them a little more energy being put into the area, and again, my question is it comfortable? And if they say I can take it, I turn it down. I can take it means it's on the edge, but no, that's fine, that's comfortable, then you're good. So I try to go to right to the edge and then back it off to make sure that the client is comfortable. In this case, if it's the first time to treat, 10 to 15 minutes would be fine on a very comfortable setting. You certainly want to get the client to where they understand it, to where they feel it, and they feel some relief. And so I would go at a comfortable setting, not necessarily saying I'm going to be on low. I would go for comfort and as much energy as you can apply to maintain the comfort, and then I would go for 10 to 15 minutes type of session. If you wanted to go just 3 or 4 minutes at a moderate setting and just see how they're feeling and then come back and do another 10 minutes or so, that would be another way to approach it as well. They were saying that this particular client had done muscle relaxants and pain relievers and for 4 days, but they had backed off because of the side effects that they were feeling. And also in this type of situation, if it's a chronic issue, you may want to treat it a few more times. So I would say typically you want to have this client understand that you want to do at least 3 or 4 sessions so you can get ahead of what's going on. While 90% of the people feel relief after the first session, if it's an acute situation or a chronic situation that they've had for a good while, it could take a few treatments to get them to the comfort and relief type situation that they're looking for. Good morning, folks. Thanks for being with me. We're certainly glad that you're here. If you have a question, put it in the chat box on Facebook or YouTube, or if you are with us on Castbox, you can post a question in the Castbox question area, and I will certainly try to answer it at that point. Can you fly with machines is a question that I've been asked, and the answer is yes. You certainly have to go through the TSA, and if the TSA folks have never seen a device like this, it could be a little challenging because they look at it, they don't understand what it is, they want to swab it, they'll certainly put it, which everything goes to the x-ray anyway, but it's got elements in there that look, someone could say, oh, that looks like a bomb. Well, it could, with the capacitors and everything that are in the device. So as it goes through, they're certainly going to ask questions. But it is safe to fly with the devices, and most people do. Some of the machines are too big to be used as a carry-on. What I always recommend doing if you're flying is to check it at the gate. Take it through, because it's handled a little more gently if you check it at the gate. If you check it at the counter, it goes down the conveyors and it drops and can be handled a little more harshly, and not that they're trying to break or anything, but they just they throw them, they'll toss luggage and things around. So if you can handle it smoother, you're better off. But yes, you certainly can fly with the devices that we have today. Let's see, anyone a flyer? Yes, there's flyers available. You can go to the Facebook page under forms, and there's various flyers that are available. You can call the office if you're a practitioner and talk with Stephanie, and she will certainly guide you in the right direction with regard to the flyers that are available as stock items, or if you want to have custom flyer done, we have Chris in-house as a graphic artist, and he can design and create anything that you want with regard to your marketing materials that you'd like to use for your business. Another question, I had a woman call today who is having severe pain in both of her shoulders after going on the monkey bars in one of her Spartan races. She says she can still do push-ups and burpees, but cannot reach over her seat to pick up her purse. My first thought was torn rotator cuff or labrum. She's not been to the doctor. Well, obviously something could be stressed or hyperextended in her shoulder at this point, and just needs to have some relaxation and some energy applied to the area. And that's where MagnaWave comes in very well, is to go to those areas and help treat them. What I would do is treat both shoulders, much like we've already discussed a moment or two ago with someone with arthritic pain, but I would treat both shoulders with the butterfly or the large loop in order to get some inflammation reduction in the area and relieve some pain before they go to the doctor. If that takes care of it, it may not be anything more serious than just a minor strain, but it's always good certainly to check with the doc. But that would be the way I would approach it, would be with the, hey, Puce is in the house, and join us today and work with Elaine. Our Puce is one of our business consultants that we use, and he does a great job, and we're always happy. He's from Phoenix, so we're always glad when Puce comes in to spend 2 or 3 days with us. So he's in the house. Protocol for someone that has a migraine coming on. Migraines are no fun, but certainly if you feel one coming on, what a lot of folks would do is take the butterfly loop and put it on the back of the head, or you could take the large loop and rest it over the top of the head and treat in this fashion. Again, you'd want to go with a comfortable setting if you're treating a migraine, and something that we always recommend is to treat the feet. So you treat the head for 6 to 8 minutes at a very comfortable setting for relaxation. You could treat the upper body, the shoulders and the lung area to get good oxygenation in your lungs to help feed good oxygenated blood to the head as you're dealing with your migraine that's coming on. And then we always recommend to treat the feet. That would be placing your feet on a paddle or put your large loop on the floor and put your feet in the middle of the large loop and treat. So it's a reflexology type of thing. And we found that by accident several years ago. I was treating someone with a headache, and then they were saying, well, my feet are kind of bothering me. Can you treat my feet also? So we went to treat her feet at the same time, and she noticed that the headache was just, wow, just the assimilation of the two, and we found that that's very effective when treating headaches, migraines, whatever it may be, would be to treat the head and the feet as well. Let's see if there's any questions that have come up. Treating a client with benign prostate hypertrophy, 2 weeks treatment, and then what? Well, Liz, that's a great question. I've had my own issues with prostate. What I have done, what I would do is have the client sit on the loop. I treat myself regularly. I treat myself every day. I had my prostate scare about 3 years ago. And it was a deal. The doctor came, and I apologize if I'm being redundant for those of you who have heard this, but the doctor said, I don't like it, your PSA's high, I don't like how it feels. Did an ultrasound, they didn't like what they saw there. They did an MRI, they didn't like what they saw in the MRI. At about 8 weeks, I treated myself every day, twice a day, sitting on the loop for 8 to 10 minutes. I also used the Hydrowave water. At that point in time, I would take that daily, and at the end of the 8 weeks, when they did the biopsy, it was benign and dead. So we were very happy with that, and I get checked now every 6 months by my urologist, and 3 years later everything is in good shape. And I have a history in my family of prostate cancer, and so we monitor it closely, but that's what I did. And so that's what I would recommend, Liz, for this particular client, would be regular treatments, at least a couple of times a week or maybe once a week as they get in control. But I would do a series of every day for 6 to 8 days, and then as necessary. That could very easily be someone, if it's benign and they do have this, that they might want to have a B2 machine or something like that they can use daily and stay ahead of what they're doing. But if they don't want to do that and they want to come to you for treatments, I would treat regularly, whether that's once a week, 2 or 3 times a week. Once they have the inflammation controlled and they're happy with that, then they may only need a treatment every 2 weeks to stay ahead of the situation. situation. And you can tell people that have prostate inflammation issues. I can tell when I don't treat myself, if I miss 2 or 3 days, if I'm camping or traveling or doing something like that and I miss 2 or 3 days, I can tell the flow changes, things change, so I try to stay on it, treat myself on a daily basis. So that would be my recommendation. We've had very good results with people that have used the devices to control the inflammation in their prostate. And as we age, it certainly becomes more and more of an issue for men. Let's see. I was asked if it helps with weight loss. Well, if you improve someone's sense of well-being and how they feel, they may approach their weight loss a little more aggressively or a little more with confidence in what they're doing. So just from the sense of well-being, can it aid? If you wanted to place and I've got a couple of things I'll go through here. If you wanted to place the large loop potentially on your belly and do some crunches, it will help that in terms of muscle development. And can that exercise help with regard to weight loss and muscle control and body control as well? Certainly by keeping yourself clean, the detoxification that can accompany the utilization of these treatments can be beneficial for your weight loss and what you're doing, just to have good blood flow, good blood oxygenation. So from that perspective, it could be beneficial. And working with a doctor out of California, Dr. Randy, who uses light therapy, and I've experimented with it. I need to get back after it, but he's got a little device, light therapy device, that what he would do is he'd put it on, let's just talk, for example, the love handles or your waist, for example. You put it on there for a couple of minutes and move it across the body, and then we treat with the mat, or we treat with the large loop, which what that light does is the light actually shrinks, much like turning the fat cells into like raisins. So the fluids come out of the cells, the size is reduced, and then you use the device to treat the area to stimulate and get the fluids and what comes out of the cells into the lymphatic system and out of the body. And we've seen very good, and we're going to start talking about that more and bring the lights into our line to be utilized for this, to take in conjunction with our device and be able to use it for slimming and for weight control at the same time. So that's kind of interesting. Yes?
Elaine did a webinar a couple of months ago about weight loss, and it's in the comments if people want to reference that as well.
Sure. So there is a webinar that Elaine did dealing with weight loss and PEMF, and so the link is in the comment section there. Great. Thank you, Chris, for that, and folks can have a look at that as well. So if you have any questions, just simply give them a post and we'll take care of it. If you'd like to speak with me, send me a text to 502-599-9722 and I will call you back. Let's see here. Good morning, Mary. Let's see, my stomach when I feel hungry. I do my stomach when I feel hungry all the time. I do 2 minutes at a comfortable setting and my hunger goes back to normal. That's interesting, just to stimulate your stomach if you're hungry. Very interesting, Samantha, sharing that with us, how you utilize it for that. I'm going to try that. Not done that, but I will do that, perhaps report back and see how that is working out. Let me jump over here to Castbox and see if there's anything there. Questions? Nope, just got some folks joining us and listening in on Castbox, but no questions at this point. Let's see here. Let me come back over to Restream. No other questions. Let me make sure I didn't miss something. No? Okay. Just post your questions if you have them, and we'll certainly take a look at them and answer them for you. Is it possible to list the Gauss output of the MagnaWave Semi for the different attachments? Recently purchased the 18-inch wave wings, and I would like to know. Yes, there's also a video that I did with the Semi 3 showing the various Gauss levels that make it available and within the FEI regulations for the use of PEMF in the United States. So that is there, and we are in the process of posting this information, and we will have it available for you to get those Gauss levels. I don't have them at my fingertips this morning, or I could give that to you. One of the problems that everybody has with Gauss, just to address that, we kind of talk about it in energy, but when these devices were first made years ago, they determined the Gauss because it's very difficult to have a meter that will measure these devices, because on the high voltage devices the signal starts and stops. It actually goes off, and the magnetometer is designed to read a signal that is continual, a signal that would be like a sine wave that doesn't stop, it just continues, it pulses up and down, and that can be read with a normal magnetometer. A signal like ours that starts and stops, it can't. And so the Gauss numbers were established by mathematical equations. If we have this size capacitor, this many resistors and so forth, then you're going to have this amount of power. Well, in a perfect situation, that's what you would have. But the attachments change the Gauss that's delivered. One attachment's larger, creates less Gauss, a lot of muscle movement, but less Gauss because of the size of the attachment. If it's small and very direct, then you'll get more Gauss out of the attachment. The machines are designed to be able to power, let's just say, 10,000 to 20,000 Gauss on the very high-powered machines. But the coils themselves change what is delivered. People have used numbers over the years that they've created out of their head or on mathematical equations, but when you go to measure them, and we have developed a device that will measure these machines. But what happens when you get the real numbers, people say, oh no, mine's a lot stronger than that. Based on what? Well, we just figured that what it is. And I'm not slamming anything. I mean, mathematical was the way to do it. But now that we have devices that will accurately measure it, when you come up with the real numbers, not that they're low or anything like that, that's not it at all, but people are used to hearing numbers that are not necessarily accurate, and so it's very confusing when you put out the real numbers and people don't understand how all the numbers are shaken out. That's one of the things that the AOPP, the Association of PEMF Professionals, is going to strive to do, is to be able to take all the machines on in the marketplace, measure them so you know, and they can post, and so people will be able to know with an accurate measuring device what each machine is doing, what the different attachments are doing, so you, the public, can understand the strength that you're looking for, or understand what type of strength a device has. That's why we talk a lot in the terms of energy. We want to put as much energy as we can into the body, into the area, comfortably, to help the body be in a better state to better heal itself and function the way it's meant to do. Let's see, is it list the Gauss? So we'll get into that, Mary Ellen, great question. If you call the office and talk with Erin and about the specific device you have and the attachments that you want to use, she can give you those numbers perfectly. When I wrapped a large butterfly around my abdomen, I started losing inches immediately. Sandra, there you go. Sandra Snell, Dr. Sandra Snell. Very interesting, and it makes certain sense, Sandra, that you would achieve that, because you are stimulating, you are massaging the area, you are stimulating the muscles in the area, helping strengthen those muscles, and so that is certainly a nice, hello Elaine, good morning.
Good morning.
A nice situation that can occur. Sandra, thank you for sharing that, that she's started losing inches immediately. There you go. I need to get busy on that, so now I got a lot of work to do with my PEMF devices. Sandra, thanks for sharing. Any other questions, folks? Just put them in the chat box on Facebook, on YouTube comment section, or if you're listening to us on Castbox, I'd be happy to answer your questions. There are several people listening over there. That's great. We've been going about 20-30 minutes, and we will stay as long as we have questions. So if you have a question, just put it in there. When treating migraines, do you use a small butterfly loop over the head or the Zoom paddle? Well, you can use any attachment that you're comfortable with if you're treating a migraine. Certainly the paddle puts out more energy than some of the other devices, and I want to talk about that for a second, but basically you would use the paddle at the base of the head and then rest your feet on the paddle if you're wanting to use the paddle. The paddle is an interesting device, and on some of the machines where it's producing more Gauss or more energy than some of the other attachments, in many cases it does not feel as intense. Now that's that goes against what a lot of people feel. You put the large loop on a shoulder and you can hear it much more. I mean, it's a click, 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 and you're seeing more movement, whereas when you use the paddle you won't hear it as much. It's a different type of sound, and it may not feel as intense, but the energy level that you're putting in is in most occasions twice what you get from some of the other attachments. So the paddle is a very versatile attachment, but you have to understand how it delivers its energy a little differently than the others. The other loops are circular, and the energy and the field comes out kind of like a fountain, whereas with the paddle it's wound in a true Tesla coil fashion, like a watch spring, and it shoots more like a spotlight, and so it's just putting more energy and more intensity coming out of the paddle in that fashion. Let's see, if you buy a machine and get one certification, does that certification include all 3 human, horses, and pets? That is correct. We have 3 levels of training. We have training for horses, training for small animals, and training for humans in the operation of the machine and what you can expect, and guidelines for how to use it in all 3 of those areas. So, and a certificate or a certification course allows you to do all 3. Some people come in and only want to do horses, or they only want to do small animals. That's fine, but it's great learning to go back and forth, because if it works on a horse or a small animal, it'll work on a person, and vice versa across all 3 fields. But that's the question. Let's see. Oh, okay. The certification people answered that question also. Any other questions, just put them in the area there, and I'd be more than happy to have a look. Let's check over here on CastBox and see if there's anything in. No, everything's quiet there as far as questions are concerned. Thank you for listening, you folks on CastBox, and certainly those of you who are with us on Facebook and YouTube Live. We thank you for being there. And as you know, you can ask your questions anytime you want. If you'd like to talk with me and have me call you, just send a text to 502-599-9722, and I'll give you some MagnaWave gear if you will call in and we have a conversation. I like to do it that way because we get a lot deeper into the subjects when we actually talk about it as we go through. So let's see. Got a question? Put it up there, please. Sandra talks, my paddle doesn't seem as strong for small animals and people life after I had the horse stand on it in the Zoom box. Is this common? That's an interesting question. Doesn't seem as strong after I had a horse stand on it. Sandra, we might want to have that looked at. There should be no reason that would be an issue. However, in some cases there could be a wire that's come loose and it is affecting the strength or the signal that you're putting out. We certainly always want to make sure all those attachments work properly, and so call the office, talk with Lee, and we'll see what we can do to make sure that you're in good shape with your attachments, Sandra. Thanks for bringing that to our attention and discussing it. We certainly, these devices are very durable and things last for a long, long time, but that doesn't mean that something can't go wrong. I mean, I've had folks that have had machines and I've watched them fall off golf carts and drag them all over the place, and I've drug these machines all over the country in an RV and cars and airplanes and everything like that, and everything works great, and all of a sudden one day you pull on your machine, you go down a little 4-inch curb, and bingo, something comes loose, but it's been on the verge of potentially coming loose for a long while. The longer these machines work, the longer they will work, it seems like, and but you never know if something is going to come apart and cause a problem, or when that could happen. All right, let's see. Any other questions? Just put them in there, and we'd be more than happy to have a look and answer those questions. How long should I treat a pulled hind leg suspensory, and what would the recommendation be for time and intensity? They have the max. Quincy, great question. I would treat, as you know, my byline is treat as long as function continues to improve, and then treat as necessary, as often as necessary to maintain the result that you've received. And so I would say on a suspensory, of course, you're going to know if it's better. The doctor may look at it, or you can tell the inflammation's gone, movement is improving, so on and so forth. But I would certainly stay on that type of situation regularly for a period of time, whether it's 3 times a week or every day, and then as often as necessary to, again, maintain that. If you get it to where it's healed itself and everything's in good shape, you can certainly stop. But there is no set time. But I would certainly say for a suspensory type of situation where you're dealing with tendon and cartilage and nerve and all of that, that it's going to take a little time to get it to heal. So it could be a few weeks that you need to treat regularly, and certainly monitor it and have the situation checked. I guess I can't say treat it at this level of intensity for this many days. When you're dealing with a horse or an animal or a person, when you're dealing with the knee or the ankle, you can apply a lot more energy to the area comfortably. So when you're treating that, you don't always have to be on a low setting, where you can be on a lower setting. If you're comfortable with that, do that, just treat a little longer. But when you're dealing with those types of issues, you can, as I say, apply a little bit more energy to the area to help speed the process along. Good question. Let's see, no other question there. Let's see, tendon ligament injury. We thought she was lame, high nail, but now it looks like the MRI is in order. Recommendations for treatment. Issue is in the suspensory apparatus. Again, if you have a situation like that, start treating. As soon as you can start treating, the better off you are to get rid of the inflammation and allow it to move forward to be in a good healing position for the body. Let's see. How does one renew their certification? You simply, every 2 years, your certification lasts for 2 years, and then we have continuing education courses to reestablish your certification. If you got a certification due and you come to MagnaCon and attend the classes and the courses that we have at MagnaCon, that works for your certification. We do have ways to do it. If you have questions, call the office, 502-724-7868. And ask to speak with Erin. Erin is a director of training, and she'll see where you are in your certification and tell you what you need to do to keep your certification updated. People have talked about, why do I need to do that? Well, things are changing. Guidelines change. Machine strengths, there's different machines, and so it's just important that you keep up with what's going on, and so when you talk to your clients, that you have all the information that you need, that you present the information in a very secure manner. So that's what the certification helps you do, is to be on your game, understand the therapy, understand what you're doing, and be able to converse and help people understand what they're going to receive from this type of treatment to their bodies for their health and wellness and well-being. So call the office, talk to Erin, and she'd be more than happy to talk with you. How long does your financing spread the payment out if a person can put down approximately $6,000 to $8,000 for a Pulse Pro or Julian, Equine, or Human package? Well, we have various financing packages available to you, and so it depends on where you are, what your credit is, and some of those information, those types of questions. But we can very well tailor a package to be exactly what you're looking for, and the best way to handle that would be, again, call the office, speak to one of our sales reps, or go online and put some information in, and then one of our product professionals will contact you and go over all the financing options that are available, and there are several. So we want to make sure that you're happy with that and it works out for you. I have a client whose horse has EPM, EDM is what they put. I'm assuming they mean EPM. What is the best protocol? And when we're dealing with EPM, there's a couple of things to know. That treatments are quite often continuous because it's very debilitating, potentially very debilitating situation for the horses, and can have long-term effects that they need continual treatment. In many cases, that's not always the case, but that is the case in a lot of a lot of different times. The typical protocol would be to wait until the medication has been administered, and once that's completed, then we begin treating to help move the parasites and to help heal the areas where the parasites have caused damage to the nerves along the spine and in the body. And again, there's many different ways to approach it. Talk to your veterinarian if you have that type situation. Some veterinarians are beginning to recommend that when they're giving the medication that you're treating at the same time. No issue with that. In the beginning, we just followed the direction of the veterinarians we were working with, and many of them felt it was better to wait until after the medication was administered. That's changing a little bit today, so I'd check with your veterinarian, but you can do as you feel is comfortable, but I certainly always recommend talking with your doctor or your veterinarian in those cases. Let's see. Okay, ask for a call. Someone's selling a lawsuit this week, but I think I'll be able to work something out very shortly. Good. It's always good to settle lawsuits and get those kind of things behind you, whatever they may be. Any other questions? Just put them in the chat box. I'd be happy to. AJ says hi on CastBox. Good morning. Thank you for being with us, AJ, on CastBox. And let's see, no EDM. Well, EDM. So I was talking about EPM. Let's go back here, and you've kind of got me on the EDM. Let's have a look here.
It's a big word.
Equine Degenerative Myeloencephalopathy. Okay. Is an inherited neurodegenerative disease. So it's inherited well, you know, what I would do is certainly to improve blood oxygenation and blood flow to the body where they're having these types of issues with the EDM. Now that I understand what it is, sorry about that. But treat the area. Treat the upper head and neck of the horse. I would certainly treat the top line with Oshiro's principle for relaxation. But if you can if you can help the body have good oxygenated blood to the area to help any inflammation that's caused as a result of this inherited degenerative type of situation, obviously you may not be able to cure it. You may be able to make it more tolerable and be able to be dealt with in a more happy type of fashion. But certainly it's very simple. Put it on the area and treat. So I would treat much like you would treat the pole of a horse by simply resting on the atlas or the top of the head, or approach from the side. You can treat the whole head itself and the neck area, and again work to get the inflammation in place, get whatever's causing the instability and the pain, maybe let the body regulate that a little better on its own, but certainly worth a trial to do that. I always say, or always feel like when we have conversations, that good oxygenated blood can do a lot of good for the body in terms of a lot of different situations that are going on. I mean, we live on air, we live with oxygen, we live with everything that we're trying to improve in the body, and so it only makes sense to make sure that the blood flow in your body is at its optimum, and as far as oxygenation and as far as flowing and all of that, that just allows the body to be in a good state of healing. Let's see. Oh, there's no other questions there. Let's come back here and see anything else. Please let me know if you can in an email. EDM, I got that. Understand what it is. Yes, thank you. It was due to a lack of vitamin E. Interesting. And Aaron gives a treatment recommendation all there. Allison writes, is an online process. Oh, someone is responding to the question on certification. Thank you. I always appreciate, and I'll tell you, actually, if you want to learn to go to the if you're a practitioner, utilize the practitioner group, because it's a great place to get information, to learn more, to have people answer your questions. It always warms my heart when I go to the certification page, or I go to one of the other research areas like the MagnaWave PEMF International Research and Education Group, which is a place you can go and search for answers. I'm just amazed at how our practitioners come up and share with people asking questions what they did, how they approached particular situations, what guidelines they have used to help them be successful in working with many different situations that people have with themselves, their small animals, and their large animals, the horses and cattle. Let's see, I have 2 horses, and one had a near eye and one having cancer surgery today on foreskin. Best protocol. Let's see, 2 horses, one had near eye and having cancer surgery today. All right, I don't, as far as the cancer surgery, once on the foreskin, once everything is done, you can certainly treat the area to keep inflammation at bay and to speed the healing process from the cancer surgery. Near eye, I'm not real clear what you're referring to there. Maybe you could clarify that, and I can take a look at it. Is there a number to call Pat? There is. If you'd like to just call the office, and I'd be more than happy if I'm here to talk with you, and they'll put you in contact with me if you would like to visit. I'd be more than happy to talk with anybody that has questions that they're wanting to discuss, and certainly we can do that. If you're talking about today, if you want to call in and ask a question or talk, send me a text to 502-599-9722, and I'd be happy to call you back and have a discussion about whatever it is that you would like to talk about with regard to PEMF, and or call the office and they'll put you in contact with me right away. Always want to, it's something that we fashion ourselves in wanting to do, is to be available to answer any questions that you may have, and always be readily available for you, whether that's me. If you have marketing questions, you can call and talk to Chris, our marketing person, and we can talk to you about videos. Tony's here to deal with videos, whatever questions you may have. Certainly Aaron's available, and the training and education to answer any questions that you may have. Lee is available to help you with machine repairs or anything that you need to have in that type of situation, and then certainly our product professionals to answer any questions that you may have with regard to our products. So we're here for you, and we're here to talk to you, and we feel that that's something that I don't want to, that sets us apart. Being transparent, we try to be totally transparent on our website, to put all the information on there. We don't want to try to force you to do something in order to get the information that you're looking for. And Art Steele just tagged in and said he's got a question on the quads, or not a question, but a protocol on the quads. We'll get him on the phone here maybe and have him talk about that. Okay, let's get Wendy on the line, see what she's got. Okay, here we go.
This is Wendy.
Hey Wendy, Pat Ziemer, how are you?
I'm good, Pat. How are you today?
I'm good. And you have a question?
I do, sir. So I now own the Maya and the Soul.
Uh-huh.
And I sometimes go to homes where I have 4 or 5 people, and I'm trying to cut my treatment times. So I'm using the Soul on the torso and the Maya on knees, feet, that sort of thing.
Okay.
And what I discovered the other day, and I was wondering if you could help me with this, I set the 2 machines next to each other and run the coils to the person, and when the coils cross over each other, the Soul will affect the coil of the Maya.
Correct. And what you don't want to do is you don't want to cross the coils.
Okay.
You want to keep them separate. And basically what's happening is there's certainly electric signals going through those coils, and if you cross them, they get a little confused. And the Soul being an analog machine, whereas the Maya is digital, the Soul will interfere more rapidly with the digital device than the digital device will with the Soul. And so that just creates a little structural interference between the two. What I would do is maybe set them on either side of the person person, maybe have them that way, so not only are the coils a little separated, but the devices are separated by a foot perhaps, just to do that. But the secret is not to cross the wires or the coil leads cross over each other. Keep those separate as possible. Does that help?
Busters, don't cross the coils.
That's correct. That's correct. You're not really going to hurt anything, although it is possible. I mean, that digital device is designed to run smoothly, and it's designed not to have interference with itself, and so in theory, you're not going to hurt anything. However, if you did it every day and you did it all the time, then that could start playing with the brain of the digital device. So I just would work to keep them separated. Just don't cross over each other.
Okay, and the machines themselves, should they be separated by any particular distance, or does that matter?
It's not as critical as the coils, but I'd keep them a foot or so apart.
Okay, great.
Yeah.
Thank you, Pat.
You're welcome. Thank you for calling. Have a great day. Now send an email to support@MagnaWave PEMF, and we'll get you some gear.
Great. Thanks, Pat.
Okay. Thank you. Bye-bye.
Bye.
So that was a great question, Wendy. Thanks for asking. And that is more and more people have more than one machine now, and they're using them for, as she said, how she applies the two different machines to various areas of the body and how to utilize it. And certainly, when you're doing that, there are things that you want to steer clear of so everything works at its optimum performance. Let's see. Okay, if someone wants to visit, there's the number. Spot near the eye had sarcoid being biopsied, having chemo treatments. We're working with some folks where they actually go into those types of tumors. They'll inject the chemo. There's two ways to do the chemo. They can go directly into the tumor itself, and then you can treat with an electrode device or a PEMF device to help intensify the chemo in the tumor to reduce and hopefully kill the tumor itself. And so the other way is that they would do the chemo intravenous to where it goes through the body and to the area. So however they are applying the chemo. We have learned that the devices are very effective for reducing inflammation in tumor type of situations. And again, you want to work closely with the doctor, but in the near eye where they have the sarcoma, it could be very beneficial. If you'd want to talk about that, the thing to do we'd be happy to discuss that with the veterinarian or with you, and to talk about the different ways to approach it. But basically what you want to do, if you just imagine that this is a tumor, you inject chemo in the tumor, and now you use the pulsed energy to enhance the chemotherapy that's taking place to reduce the size of the tumor and to actually the oxygenation that's improved. The cancers do not like oxygen, so if we can improve the overall oxygenation to the area and to help reduce those things, that certainly is a very viable way to approach that. So if you want to know a little bit more about those processes, give us a call and we can talk about that further. Great question. Thank you for clarifying that so I can understand what it was. Hey, Suzette, thank you for being with us, and be more than happy to visit with anyone. Let's see if we've had another question. No, we got the one text message from Wendy. If you'd like to visit with me, send a text to 502-599-9722. We're about out of time. Time flies when we're having fun, and we certainly appreciate that. Let me check over here one more time, see if there's a question here. No. Those of you who have listened on Castbox, thank you so much for being with us, and we're going to expand our Castbox presence with I don't really know how often we're going to do it, whether we do it once a week or 2 or 3 times a week, have radio broadcasts at various times of the day to answer specific topics that we will be addressing in the Castbox area, plus the office hours on Tuesdays. Let's see, any update on the face? I need it for myself. Also, I love MagnaWave. Thank you. Otherwise, I would have to put my horse down already. And then that wonderful that you're having those kind of results. The face mask, as I shared last week, I guess it was, it's just something that we are developing, to have it pliable enough to have the material that's easily cleaned, easily used. That's the whole thing that we're dealing with, and that takes some experimentation. You can have a good material, but then it's not flexible or it's not comfortable. And so we're just trying to do this so when we bring it out shortly, hopefully, that it'll be good and ready to go and adequately used. With that said, certainly the large loop over the face will produce the same type of thing that you're looking for, just maybe not as intense comfortably, but you can certainly use the large loop or the butterfly loop over the face for whatever purposes you're using. They've used it before over the face. What some folks have done is they'll take a product, a hyaluronic acid type of product like Lubricin, and they'll put that on their face, and then they'll treat to get the Lubricin, help infuse it into the area to help plump things up and lower or reduce the size of wrinkles or make wrinkles kind of disappear, if you will. It's not an instantaneous process like taking pain out of a shoulder or an elbow, but it used over time can be very beneficial for whether using it for plastic surgery repair and relief after surgery, or just to maintain good suppleness to your skin on a daily basis, is something that could be very beneficial for folks to use. So great questions. Thank you for the questions that you're asking. Let me make sure there's nothing else here. Everything looks to be good. I always enjoy being here with you folks, and if you have questions, you can send them in through the week, and we'll have them for you come on Tuesdays when we have this program. So thank you so much for joining me today. I'll be back next week with another edition of MagnaWave Office Hours, and it's always a pleasure. Wave on to better health and happiness, and we're glad to have you with us. Have a great day. Bye-bye.